Now let's talk about something that's quite near and dear to my heart. It's really picking up a lot of traction in regards to the simplicity of what to do when coming across a cardiac arrest victim outside of a hospital setting and it's a bystander who may not have any training at all. Now, for years and years, I've always said anything is better than nothing when you're responding to a medical emergency. In fact, one of the biggest problems we have in bystander CPR is not that they're doing CPR wrongly, it's that they're not doing CPR at all. So in hands-only CPR, which has been termed by the American Heart Association, it's also known as compression-only CPR. The one differentiation I'd like to make there is that compression-only CPR is a little bit of a contradicting term in so much as it's compression-only with no resuscitation respirations. So we're looking at compression-only cardiopulmonary resuscitation. I think it might be better termed compression-only resuscitation. In this effect, one of the concerns that I have about compression-only CPR is if you're able to do full CPR because you have personal protective equipment, do not fear contagious diseases, and you have the ability to learn something as simple as 30 compressions given by followed by 2 breaths, that's the optimal way to deliver a life-saving skill like CPR. Compression-only resuscitation circulates only really, at this point, the residual oxygen already within the body, with a lot of still hit and miss studies coming back about how much oxygen and carbon dioxide is being exchanged in order to oxygenate this body and keep the body in what we call a hemodynamically stable position so that they respond to defibrillation and life-saving medications. So if you're able to sign up with Pro CPR or Pro First Aid and get on the weekly email list, we're going to send you free email reminder videos every week in your inbox to keep you fresh with any of the videos on how to do this life-saving skill we call CPR. In my opinion, that's the best thing you could do for anyone in cardiac arrest. But in the worst case scenario, if a person was bleeding from the mouth, you did not have personal protective equipment, a person maybe didn't know how to do CPR at all, the science is really promoting that if we do fast and hard chest compressions of 100 compressions or more in a minute with deep 2-inch plus compressions over and over, that the science that is there, which is quite small at this time, but at least there's some positive science that says it does circulate some oxygen to the brain, the heart, and potentially some vascular organs for a few minutes in the first minutes of cardiac arrest. This is specifically designed for patients who were witnessed in going down in cardiac arrest. So this is the way that this compression-only resuscitation works. It's outside the hospital. We see someone collapse. We respond to them, and we ask if they're all right. Are they okay? Can you hear me? There's no response. They do not appear to be moving, breathing, or making noises. Instantly, we activate the emergency medical response team, 911, or the ambulance, and we go right into compressions. No gloves are needed in hopes that there's no blood or body fluid on the thoracic cavity of the chest. Now we're going to lock our fingers, lock our elbows, and with the palm of the hand, we're going to go down at least 2 inches, and we're going to go at least 100 compressions per minute. And we're going to continue these fast and hard chest compressions over and over and over and over and over until help arrives or someone with equal or better training takes over. Please make a note though, it is so easy to combine simple rescue breaths with a head tilt, chin lift, pinch the nose, open the mouth, seal the mouth, give 2 breaths, and circulate that around, that until we have more science backing that the cardiac compression only resuscitative efforts are equally as good for long-term CPR or for CPR in general, get the training. It's going to be the best way to do CPR to give your loved one or someone else's loved one the best chance of survival. But if you don't know anything at all and you want to try to help, at least start compression-only resuscitation and do 100 compressions per minute or more, as deep as you can, as fast as you can, after calling 911. and hopefully help will be just around the corner and can take over from there. Sir, are you okay? Are you okay? Yes, hi. This is Roy Shaw. I'm in Grand Rapids, Michigan. I'm on the scene right now of a man who collapsed in front of me. I came over to ask him if he's okay, and he doesn't respond. No, he's not breathing. No, he's not moving. Yeah, I know how to do hands-only CPR. Okay. And that's about it. That's about as difficult as it gets. This is a skill that is going to become extremely exhausting. Give me about 2 minutes of 100 compressions or more per minute, and I don't care what kind of shape you're in, it gets exhausting. Ideally, a good Samaritan, though they be few, 1 out of 10 maybe, someone should hopefully stop, and if they do, if they don't know what to do, it's easy enough for you to show them to do chest compressions, where to do the chest compressions, how deep to do the chest compressions, and how fast to do the chest compressions. Compared to no CPR at all, this is at least better than nothing. In ideal situation, in a city setting, you have 2 to 3 to 4 minutes max after a 911 call. You're going to get first responders on scene, professionally trained and able to help bring an AED and take over. But while you have a bystander, if there's a delay in response and you're becoming exhausted, ideally the other person will be able to take over for you so that you're not compromising the depth or the rate of the compression in order to keep those blood pressures up as much as possible, circulating as much as possible, buying time for this person to survive.